So in this last part of the video, we're going to explore blood pressure in a little bit more detail, because it's something you need to know about, something that affects people. So first of all, what is it? It's the pressure or the force of the blood travelling through your vessels, and we've already explored the 3 different types of vessels. Having high blood pressure is generally not a good thing, so we need to try and avoid it if we can. Sometimes it is unavoidable, and we'll look at that in a second. So first of all, we measure it in this mmHg, so milliliters of hemoglobin that's in the blood, and that's the measure, just like BPM is the measure of heart rate. mmHg is the measurement of blood pressure. And you might ask, well, what's normal, what's not normal? So let's look at, first of all, a normal blood pressure reading. But in order to understand that, we need to know the terms systolic and diastolic, okay, which is spelled like this. So systolic is blood pressure during exercise, so when it's contractile blood pressure, whereas diastolic is relaxing. And we've already spoken about sort of relaxing heart rate, recovery rate, relaxing being at 60 to 80 beats per minute. Diastolic blood pressure is the relaxing blood pressure. And the way you remember that is D comes before S in the alphabet, you relax before you contract. So diastolic is relaxing, systolic is contractile, and they normally plot it with a line over each other. So a normal reading for blood pressure would be 120 over 80. So that's what we call a normal kind of blood pressure reading. One that would be significantly higher would be maybe 200 over 160. Now, if you've got blood pressure this high, there's probably something wrong, and you probably need to go and see the doctor, the GP, and try and work out what's causing that. And we'll explore kind of 5 factors that could potentially be the cause for that in a moment. But also, you could suffer from something called low blood pressure. So if I take 90 over 70 or 90 over 60, that's what we call low blood pressure. And that's not great either. So we want to be somewhere in the middle here. Now, things like a lack of iron in your diet can cause something called anemia. So you can be anemic from a lack of iron. And that could be the reason why your blood pressure is quite low. Again, you're going to need some sort of medical intervention to help you stabilise that and get that back to the normal one. And you've probably seen the cuffs that they put around your arm. I'll show one just over here. And these are the way that they measure blood pressure in hospitals, and they kind of inflate and they go around your arm, and you can feel your brachial artery like kind of pulsating here, and it takes a reading and it gives you this reading, sort of your systolic over your diastolic blood pressure. And the final one to talk about is this one that's quite high, and there could be lots of reasons for that. So the 5 reasons typically that for high blood pressure is age. Inevitably as you get older, your blood pressure increases, not much you can do about that. Stress is a huge cause of high blood pressure, and it can make anybody, no matter what their somatotype, body type, it can cause high blood pressure. Another factor is your lifestyle choices. Do you have a poor diet? Do you have illness? Do you have a disease? Do you not do much regular exercise, quite sedentary lifestyle? Alcohol and cigarettes are other causes of high blood pressure as well. So that's blood pressure in a nutshell. Hopefully that's made sense. Like and subscribe. Thanks for following.